Happy New Year. I think we can still say Happy New Year. And welcome to the Harold Washington Library Center. I'm Chris Brown, Library Commissioner for the City of Chicago, and we're in a beacon of learning, connection, and opportunities. Libraries are longtime partners that ensure families have access to the information that they need to succeed and thrive. Each year, Chicago Public Library welcomes over 5 million visitors and provides over 4 million connections with PCs, free computer use, and Wi-Fi to connect our city and beyond to the vital resources they need. We're anchors of support for every Chicagoan, and it's why today we're so proud to be the host of the launch of the Beacon Care Portal. This innovative tool that provides families with unprecedented access to information. This state-funded and community-based services for youth with behavioral health issues and needs. It's a transformative step that empowers families to help their children thrive. And as Beacon serves as a guiding resource for Chicago and beyond, our public library will be here to help families connect and explore it, whether at Harold Washington Library or at neighborhood libraries all throughout our city. This partnership with the state of Illinois is a testament to our shared mission to strengthen our families. And now it's my great privilege to introduce Governor JB Pritzker, whose leadership has made this initiative a reality. Governor Pritzker.
Well, thank you very much, Chris. And it is always great to be back here at the Harold Washington Library, one of my favorite places in the world. I was married here 31 and a half years ago. So I'm reminded again today as I left home, I said to my wife that, happy anniversary for all the times I may have forgotten. Good morning, everyone. Thank you all very much for joining us for the launch of an exciting new chapter for children's behavioral health here in the state of Illinois. As governor, as a father, as an advocate of mental health and substance use treatment, I feel like today we are lifting a weight off of the shoulders of parents and children in distress and in need of help. For years, it's been clear that there is a pressing need to upgrade and modernize our mental health infrastructure. I've heard from young people who are brave enough to seek help, but are unsure often where to start. I've heard from parents who want to support their children, but struggle to navigate the challenges of finding care. I've heard from medical professionals that understand how transformational these services are, but also how difficult they can be to find. That is why I have made behavioral health a priority of my administration, not just investing in affordability and accessibility, but breaking down the stigmas associated with it. Today, we're launching Beacon, a new online portal designed to connect Illinois families with the behavioral health services that they need and they deserve. We are making the process simpler, easier, and more accessible for families who have decided to find care and for those who need inspiration and empowerment to seek help for an ailing family member. There's so much stigma around this issue. And for some people, the easiest way to start knowing that you need to find help is to go online and get help online without having to interact with anybody up front, and then ease your way into it. And this will be an enormous assistance to those families. Beacon is a centralized portal providing information, a case management system, and a resource matchmaker, all rolled into one user-friendly platform. But from the very moment that a child or a family makes the courageous decision to seek help, Beacon will be there for them. It will help identify state-funded or community-based services, connect with local behavioral health providers, determine your initial eligibility for state funding or support or city funding or support, and to help navigate the process. Because when someone in your family is in distress, your focus should solely be on getting your child the care that they deserve in a timely fashion. Beacon is currently online right now, and it's available to the public and can be accessed at beacon.illinois.gov. I'm going to repeat that a few times, beacon.illinois.gov. And I hope that those who are filming today, that you'll be able to add something, a chyron at the bottom, to remind people that this is available to them. Through the pilot stages of Beacon in the latter half of the last year, nearly 400 cases were entered into the portal and acted upon by hospital personnel, by human services workers, and many others. 70% of those cases have already been resolved. Think about that. Speed is coming as a result of this system. That represents hundreds of families who've been connected with the necessary help. The system works, and we're now launching it for families everywhere in Illinois. We know that there are lots of families out there, and this is a resource that will make life easier for them, those who are in need. As the system goes to work for more Illinoisans, we expect to learn a lot about the features that we may want to add or changes that we may want to make. But Beacon will help guide young people and their families toward diagnosis, treatment, and resolution. I want to take a moment to thank some of the many, many individuals and organizations who have played a role in bringing Beacon to life. I know that I may leave somebody out, and my apologies, because it really was an immense group effort. But I want to start with Dana Weiner and the entire team at the Children's Behavioral Health Transformation Initiative. We could have a whole separate press conference with all the praise that I'd like to heap upon this group of people and on Dana, but we won't do that today. I'll just say that none of this could have happened without this group of people. Dr. David Albert, the director of the Division of Mental Health, and his staff, who are the bulwark behind the portal. And our tremendous mission-driven technology partners at Google, I want to thank them, and all the staff leaders and the leaders of agencies across 6 different state agencies, whose collaboration proves that breaking down silos in state government can yield success across the board for the people of Illinois. I'll just share with you that when I came into office, people didn't understand why I named not one deputy governor, but 4 deputy governors. And I'm not sure if anybody understood that the reason is because we want to break down silos, and we need, 26 agencies, I can't possibly break down the silos that exist in state government all by myself. But those 4 deputy governors who've been enormously important leaders are the ones that, when there's a problem with one agency can't connect with another agency on an important issue, or something that's a priority of mine that requires agencies to work together, that we are able to work across those agencies. Working across 6 all at once is monumental. And there's a lot of credit due to a lot of people, but one person I'll call out is Deputy Governor Grace Ho. Yeah. I also want to thank, behind me are a number of members of the General Assembly. A couple of them will come up and speak, but I just want to thank them for their continued support for expanding behavioral health in Illinois, and for being great partners in thinking about and advancing the broader cause of healthcare for the people of our state everywhere. And lastly, I want to thank Summer George, a parent and advocate who you're going to hear from in just a couple of minutes. She's going to share her story as someone who has experienced these challenges firsthand, and who's faced them and in many ways overcome them head on. And she's been amazing, and I want you to know her story. There are parents all over Illinois just like Summer. Let me say to those families who worry about identifying and providing their children with the help that they need, and to the many young people across Illinois who are struggling and don't know where to turn to, you are not alone. We are here to help. And with the launch of Beacon, you have an easy and accessible place to start. If you need help for a young person that's in your life, or you yourself are a young person who needs help, and maybe truly suffering, mental health, substance use treatment. Beginning right now, today, again, you can visit this behavioral health portal online. You don't need to talk to an individual right away, but you can eventually as a result of working through this portal. And again, it's at beacon.illinois.gov. And with that, I get to hand the podium over to one of our state's most ardent advocates for behavioral health, truly a champion for Illinois families, and my partner in governance, and that's Lieutenant Governor Juliana Stratton.
Good morning, everyone. And thank you, Governor, for your kind words and your passionate dedication to Illinois' people. So many brilliant minds came together to transform Beacon from an idea to a tangible resource. And I also want to thank the fearless architect leading this transformative effort, Dr. Dana Weiner. We have so many partners from the General Assembly joining us that are here today. You'll hear from some of them. I want to acknowledge all of our state agency teams who collaborated on this project, including the Department of Human Services, Department of Public Health, the Division of Mental Health, Departments of Children and Family Services, Healthcare and Family Services, Juvenile Justice, and the Illinois State Board of Education. And finally, our incredible partners at Google. Thank you. Somebody wants to applaud Google. It's okay. As a mother to 4 girls, I know how it feels to watch your child hurt and ache to take away their pain. It tears you apart, wishing you could shield them from a heartbreak and from life's harm, yet sometimes just feeling helpless. For a while, Band-Aids and kisses can fix almost any problem. But as our children encounter the world around them, their pain morphs into something not even the most determined parents can fix. Over the last few years, our children have shouldered an unbearable weight. The pandemic ripped away normalcy. Our news feeds are painted with images of horrific climate crises. And every day, it seems like there's more bad news to report than good. Understandably, we have seen a surge of mental health struggles in our youngest community members. How do we help them navigate their place in the world when we aren't sure what tomorrow holds? In an effort to stay grounded in the present moment, I'm focused on what can be done today. And today, we are unveiling a key solution. The Beacon portal is a form of empowerment. By expanding access to early intervention support, we're offering a lifeline to families all across the state. Now, parents and caregivers will have somewhere to turn for immediate guidance, and that means children will receive relevant, reliable support faster. Simply put, this portal has the power to save lives. Beacon will lessen the burden placed on care providers by streamlining engagements, ease parents' search for resources, and assure our kiddos that their struggles are taken seriously. By investing in our children's mental and behavioral health, we prioritize their healing and Illinois' long-term health. The first parents to find support through the portal, as you know, that's already happened, are now able to point other families in the right direction. And eventually, the first children to receive help through Beacon will grow up and pass down their coping skills. Thanks to Beacon and the commitment from everyone who brought it to life, we are building a resilient community that cares for one another. Finally, let me just say to the children of Illinois, I want you to know that you are not alone. We see your pain and we hear your struggles. Your health and happiness matters to us because you are worth fighting for. Thank you to everyone who's here today. And with that, I'm now excited to pass it over to a true champion for children's mental health and someone that's dedicated to creating a more healing-centered Illinois, Dr. Dana Weiner.
Thank you. Thank you, Lieutenant Governor Stratton, for that introduction and for your leadership, and Commissioner Brown for your hospitality, and of course, Governor Pritzker. It has been a pleasure to collaborate with you, Lieutenant Governor Stratton, on the Healing Centered Task Force as we work to ensure that Illinois is a safe place for everyone who struggles with trauma and mental health issues, and we know that includes many of us. And welcome everyone to a celebration of progress in our efforts to improve children's behavioral health in Illinois. Since 2022, with the establishment of the Children's Behavioral Health Transformation Initiative, we have been working hard to make things better for kids who struggle with mental and behavioral health issues in our state. We have listened to hundreds of families, youth, providers, and partners to understand their hopes and goals for a better system. And we are delighted that today we can announce that one of these dreams is a reality. The Beacon Care Portal, as you've heard, is a centralized resource for Illinois youth and families seeking services for behavioral health needs. It puts a lot of information about services in one place, and in doing so, it puts parents and caregivers in a better position to lead their own children down the path to receiving care, with help along the way from a dedicated team of staff at the Division of Mental Health in the Department of Human Services, and many other partners. In addition to connecting families with help, Beacon gives parents the power of knowledge and information about how to request help, follow up on requests, store important documents that might be needed to quickly reach potential services. And it overcomes some of the barriers to working together across the state agencies, making Illinois a state that can serve all of its residents with the help of powerful, efficient technology, a secure encrypted platform, and clear pathways to help. Many of you have heard me talk about the challenges that we face in transforming large systems. With Beacon, we have truly carved a new path that we hope will be the easiest, most clear, and straightforward way to navigate the service landscape on behalf of children and adolescents who need our help. So as you've heard, Beacon was developed by Google in partnership with the Division of Mental Health, led by Director Albert, and leadership by the Children's Behavioral Health Transformation Initiative. It is not easy to develop a piece of technology as powerful and responsive as Beacon in 7 months. A dedicated team led by Chief Technology Officer Mike Steele and including DMH Chief of Staff Ryan Rollinson, Deputy Director Lisa Betts, Transformation Initiative Director of Operations Megan Jorgensen, and Project Coordinator Louisa Silverman, met daily, sometimes multiple times a day, with the team of developers at Google to ensure that everything parents told us they wanted and needed would be built into this tool. None of this would be possible without the support and really inspiration of Governor Pritzker, the leadership of Deputy Governor Ho, partnership with the General Assembly, and the commitment of dedicated state agency leaders who are here today. We are so lucky in Illinois to have a governor who prioritizes child and family well-being and appreciates the value of innovation for making true change for families. So while we are delighted with this progress, we acknowledge that more work still lies ahead. Our team is now turning our attention to the next set of improvements, including work with HFS on developing a companion tool that will expedite appointments and give families even more power and information to arrange services, and work with providers and state agencies to ensure that we have enough of the services we need and enough staff to make them available. We also have the pleasure of working closely with the Illinois Department of Public Health, which under the leadership of Director Samir Vora has prioritized children's mental health as a public health issue. Together with the Illinois Children's Mental Health Partnership, we will work to rebuild and strengthen community networks to ensure that the voices of people with lived experience continue to be heard. And it is now my pleasure to introduce Director Vora.
Well, good morning, everybody, and thank you, Dr. Weiner. Your thoughtfulness, dedication, and determination to make hard things possible has been a great gift for me as the Director of Public Health, but a great gift to the state of Illinois. Today's an exciting day, and I'm honored to be here with Governor Pritzker, Lieutenant Governor Stratton, leaders in the General Assembly and across government, and distinguished guests and partners as we announce this formal launch of the Beacon portal. As the director of the Illinois Department of Public Health, I can say unequivocally that behavioral health is public health. The people of our state, young and old alike, cannot be truly healthy without timely access to mental and behavioral health services. That's why we are so thankful for the governor's leadership and also our efforts to place mental health and substance use disorder as a key priority laid out in our Healthy Illinois 2028 5-year state health improvement plan. The governor has mentioned multiple times how critical of an issue this is, and it is because of innovative leaders, our partners in state government collaborating to turn these ideas into reality. Through their vision, the Children's Behavioral Health Transformation Initiative was established, and through innovations like the creation of Beacon, Illinois continues to improve the ability of parents and guardians to find the help their children need. We at IDPH are proud to partner with the Transformation Initiative to support and promote this work. As Dr. Weiner mentioned, over the past few years, IDPH has made significant efforts to bolster our programming and capacity to enhance public health approaches to children's behavioral health. These efforts including partnering with the General Assembly to bring the Illinois Children's Mental Health Partnership into IDPH. The partnership's mission is to advise the Transformation Initiative and other state agencies on designing and implementing short and long-term strategies to address children's mental health through a full continuum of care. We are privileged to have many General Assembly partners in this audience and behind me who are partners in this effort. And it also houses a youth council, legislation sponsored by Senator Simmons. Now, at my core, I will always be a general pediatrician. Having practiced on the south side of Chicago and in neighborhoods like the east side of Springfield. And one of the most devastating things was seeing the difficulty families face in navigating our complex behavioral health system. Now, we all want and wish this was easy, and it should be easy for a child or a teenager to get the services that they need. But we all know that for many, innovation needed to happen to make this possible because it's not easy. And in recent years, as the Lieutenant Governor mentioned, our young people have faced even more trauma. From 2018 to 2022, mental health and substance use disorders accounted for nearly half of all hospitalizations of youth between the ages of 3 and 17. Access to quality mental and behavioral health care has never been more important to help our young people navigate these challenges and secure the bright and promising futures that they all deserve. This is what excites me most about Beacon. It creates that front door for residents to access the services they most need. It helps with other goals too, such as increasing public awareness, as the governor mentioned, reducing that stigma, and making sure that sometimes we have the necessary desire and drive to make the impossible possible. Everybody in Illinois needs a helping hand, and the launch of Beacon is a powerful new tool for Illinois' children and families. I'm so happy for IDPH to be a partner in continuing to promote and elevate this portal so that all of our residents can have the opportunities and the access to mental and behavioral health services that they need. Thank you so much. Now it's my great pleasure to introduce another incredible and dedicated leader in state government, Dr. David Alpert, the Director of the Division of Mental Health for the Illinois Department of Human Services.
Good morning, everybody. Thank you, Director Vorhan. Thank you, Governor Pritzker, Lieutenant Governor Stratton, Dr. Weiner, and to all of our distinguished guests here today. I can't tell you how thrilled I am to stand before you to celebrate the public launch of the Beacon Children's Behavioral Health Care Portal. It is a truly groundbreaking moment for the children and families of Illinois. As director of the Illinois Department of Human Services Division of Mental Health, I often talk about our mission, ensuring that every Illinoisan has access to the full spectrum of behavioral health resources that they need. But today, I want to do more than talk about our mission. I want to celebrate what happens when we turn big, bold ideas into action. Beacon started as a brilliant idea in Dr. Weiner's Blueprint for Transformation. In partnership with the Department of Innovation and Technology and Dana's team, we started working with the talented developers at Google to build Beacon in January of 2024. By August, just 7 months later, this idea had become a functioning system with real cases being entered. 7 months. For context, most government technology projects take years to execute, but here we are with a system that's ready to help Illinois families get to the behavioral health resources they need in less than 1 year. This kind of speed and success doesn't happen without unprecedented collaboration. The Children's Behavioral Health Transformation Initiative brought together 6 child-serving state agencies, a partnership I've never seen on this scale during my time in public service. Over 25 representatives from these agencies started working shoulder to shoulder every single week, focusing on youth with challenging behavioral health needs, breaking down barriers, and ensuring that these youth get connected with the best services for them. This extraordinary partnership will serve for years to come as an example of what can be achieved when you dare to think big in state government. I want to give a special shout out to our Deputy Director of Child and Adolescent Services, Lisa Betts, for her leadership throughout this journey. Lisa and her team have been instrumental in driving this effort forward and ensuring that Beacon isn't just functional, it's transformational. I'm also grateful to the 6 partnering agencies who continue to meet every week as part of the interagency working group. Their dedication, creativity, and shared commitment to helping children and families has been the backbone of this success. So today we're celebrating Beacon not just as a tool, but as a symbol of what's possible when we dream big, work together, and refuse to let barriers stand in our way. I am so excited to see how this portal transforms the way children and families are linked to behavioral health services in Illinois, and I know that this is just the beginning. Thank you all for being here to celebrate this milestone with us. Together, we are lighting the way to brighter futures for Illinois' children. And with that, it's my pleasure to introduce Summer George, a passionate advocate and a dedicated parent who will share some of her lived experience with us. Thank you.
Hello. Thank you for having me. Last summer, I feared for my child's life. With 6 behavioral hospitalizations, 9 emergency room visits, and countless encounters with our amazing first responders, she still was in trouble. I've always considered myself an advocate, both personally and professionally. But even with my background and awareness of what resources were, I wasn't cutting it. It wasn't enough. My child's reckless behaviors intensified, and on June 1st, they were placed into their first behavioral health hospitalization. Within 24 hours of the first discharge, they broke their safety plan and were rehospitalized. It was there that we were told to start considering residential treatment for our child. I couldn't believe it. I was heartbroken. All the years that we have invested in seeking support that I thought was going to be enough for my child was not. But what was I to do? I valued her life so much. Even the emergency room workers couldn't believe the dedication that my husband and I had each time showing up. We had to sign something saying that we would accept her upon discharge. I later learned that so many parents relinquished their parental rights in the emergency room because the challenges have become too great for them to surmise. Despite my efforts, we knew that residential was a possibility for our child. I started seeking out both public and private facilities across our entire country. I quickly learned the more barriers that we were up against, whether homes didn't have beds available, age restrictions, a denial because of my child's past behavioral incidents, or the insurmountable cost to these programs. Again, we didn't know what to do. Meanwhile, my child's health continued to deteriorate with each hospitalization, adding on new medications, new case management, new plans for treatment, not to mention all the additional trauma that was just piling on. It was unbearable. Eventually, with the collaboration of Beacon and the Interagency Department, we learned about the FSP grant, to which we applied and are a grateful recipient. Today, our child is safely residing in a residential treatment facility. And though the journey continues to be long, both for my child and our family, we are committed together as a family towards healing and wholeness. Beacon represents hope. Beacon provides a seamless pathway for parents like me who are struggling to navigate the overwhelming complexities of systems to support their child's behavioral health needs. I am thankful to be residing in a state that prioritizes the needs of youth and families. I am thankful to be standing in front and behind me, so many people who are partnering with me, just one little family who needs help. I am thankful to know that we can utilize resources such as Beacon to seek the help we need. Beacon, as I said, represents hope. Together, we can be a light, a beacon, towards a pathway towards helping other families seeking support and resources for their family. Thank you again, and I hope that this resource once it's implemented and executed, will support other families and give them the encouragement and confidence of seeking support for their child. Thank you. And now I'd like to introduce Senator Mike Williams. I'm sorry, Simmons.
Well, I think Mike Williams would sound just as good as Mike Simmons, so don't give me any ideas, Summer. Good morning, everybody. I'm State Senator Mike Simmons, representing the 7th District, which covers the far north side of Chicago. And it is such an honor to be here this morning for the Beacon launch. I just am so inspired listening to Summer's story. The dedication that you have to your child, the amount of work that you put into advocating for your child is such an inspiration to me as a legislator. And I hope that it's an inspiration to all of those in this room who are stakeholders in mental health and who fight every day for families like Summers. I want to thank Governor Pritzker and Dr. Weiner for holding this press conference today to announce the launch of Beacon, the Behavioral Healthcare and Ongoing Navigation Portal, which is, as we know, a centralized website where families can access information about behavioral health services and receive help navigating the process of arranging those services for young people. In the last couple of years, Dr. Rayner and the Illinois Children's Mental Health Partnership have been close allies, in particular helping me to roll out the Illinois Student Mental Health Council, which was a product of legislation that I passed in the previous General Assembly. That council was the result of a law that I had passed that was directly inspired by teenagers in the 7th District, which I represent. We have a People's Legislative Council, which sits down constituents by groups, and the young people in my district and all of their councils consistently raised access to mental health is the #1 issue that they face, not just in terms of how to find mental health, but the stigma around mental health. And so many of our young people are so overworked and overstimulated that oftentimes what they told us is they don't even know where to start. And so having a portal like this is such an important systemic step forward in helping those young people and their families access the help that they've been telling us that they need for a long time. The law that I passed also ensures that the curricula for elementary and secondary schools would be required to include how and where our young people access mental health. So the Beacon portal will obviously be a part of that lesson. That'll be those lesson plans that'll be offered in our schools as a result of that law. And so the rollout of the Beacon portal is an encouraging next step in providing resources, not just to students, but to all families all across Illinois. Because as Summer's story makes clear to all of us, we all probably know somebody that is struggling with mental health, young people in our families, parents in our families, grandparents in our families that are often isolated and don't know where to start as well. And so, this is really going to be not just helpful to those young people, but to entire communities that are plagued by just the lack of access to mental health and healing that, frankly, is the root of so much of the violence that we see all across our country. I've spoken with countless young people and their families, as well as visited every healthcare provider in the 7th District that I represent. And what I can tell you is that even beyond the schools that we visited, even in the healthcare provider settings, even the providers raise this issue. Whether it's knowing that the resources exist at a hospital or a clinic, but the people that need it just a few blocks down have no clue where to go to actually access those resources, can be very frustrating and demoralizing to mental health workers that believe in this work, but see that systemic gap and often feel helpless to do anything to address it. And so we also know that, just a couple of years ago, I had the honor of sitting on a panel with the U.S. Surgeon General where we looked at the Youth Mental Health Council that we have in Illinois, but we talked about things such as social media and all the other unprecedented forces that are acting on our young people today, that even, a guy like me that's not that much older than our young people, look, 20 years ago, my generation wasn't dealing with this stuff. I mean, we didn't have, just unlimited stimulation and notifications and images on social media that make us feel, depressed and anxious about ourselves and where we're from. And so our young people today are just soldiers, literally, and going forward and trying to be healthy as well as their families. And on that panel, even the Surgeon General told us that, our young people right now are encountering challenges that no generation before them has ever had to deal with. So that, makes it even more important that we have a portal like this that, as the governor said, will be easy to access. It's one website where you go in and you get that case management, you get that linkage to resources, you get just an easy way of probably tackling a number of different things that you or your family might be going through. And so what I also wanted to point out is that, right now, as this resource rolls out, legislators are going to have a lot more work to do in terms of dealing with the other issues around mental health parity. So there we have a resource that's available like Beacon Portal. What happens as a previous speaker said, when there aren't enough mental health workers to meet the needs of our young people, because the great thing about a resource like this is it actually creates that pathway. But we've got to make sure that we do what we can. And I look forward to working with Lindsay LaPointe, who's been a great champion in this area of really increasing the workforce of those that work in mental health, making sure that we pay them living wages, because they are some of the most underpaid people in our state right now. And everybody in here understands that this is about the most important public policy issue that we can get our hands around, and that is the mental health of our young people, because they're going to be leading our state in a pretty soon time here. And so that is work that is worth fighting for. I want to also just quickly mention that I'm personally happy as a senator for the 7th District that I've looked, and Beacon is currently available in 7 languages that can be found on beacon.illinois.gov. My team and I have navigated the Beacon portal firsthand and can share that it is a straightforward portal that takes only a few minutes to create an account and a profile. So I really want to hear want my constituents to hear that this really is an easier way to access the mental health resources you need. And as a senator who represents a district where nearly 100 languages and dialects are spoken, I am personally grateful for the language access that Beacon offers. That said, I want to point out that I am half Ethiopian American, and in Ethiopia, we speak Amharic, we speak Tigrinya, Oromo, and a number of other languages. So I want to make sure that the Beacon portal includes a number of languages from Africa, because if you're in my district, you've got about, easily 50 different African languages that are spoken, and those communities want to be included in this too. So looking forward to pushing forward on that. And finally, I just want to say that thank you again to the governor, thank you to Dr. Rayner, and to all of our child and family serving agencies for making sure that every family and child has easy access to mental health support and the resources that they need. And with that, I will now invite to the podium Representative Tara Costa-Howard.
Thank you, everyone, for being here today. I've spent my entire life, my career, advocating for children and families in crisis. I've served as a court-appointed guardian ad litem, and I've seen firsthand what it's like for a parent and a child to need services and not know where to go. We've seen again and again the impact of childhood trauma in our communities. But it's not just on the children, it's also on the adults who never actually received the treatment that they needed. It's heartbreaking, right? We're not even sure what to say or to do at times, but it's an understanding that we need to make sure that these services are out there and that people have access to them. Many of us in this room have actually gotten those calls, right? From that parent or community worker who asks us, where do I go? I have somebody who needs help. I have a constituent. I have a client. I have somebody in need, and I don't even know where to tell them to go. And in fact, what we do is we hand them an Excel spreadsheet with a list of potential providers that deep down all of us know are already booked and they're filled. No more here in Illinois. Because I can't imagine telling another desperate parent or community advocate or friend that here's your list and go to it yourself. Now we have an opportunity. We have an opportunity to share this information with everyone about where to go and look for that assistance. That's why Beacon is going to be this godsend, right? Now we can actually direct people to where to go. And as I say that, and we've talked about what the policy was and the initiatives that were created, we have some here in the room who have their next technology step, or those in our departments who have their opportunity to see how are we going to grow Beacon. Well, we as legislators, we as community members, and we as advocates actually have an even more important job. It is now our responsibility to get the word out that this actually exists. Many people don't know about it. And it's our responsibility to go forward with this information at beacon.illinois.gov and get the word out. We need to include it in every single one of our newsletters, every single one of our pieces of communications to our community, every social media post, every opportunity to connect with our schools, our libraries. Every community resource out there should be sending people to beacon.illinois.gov for their help. And with that, I want to turn this over to the leader of the great state of Illinois, Governor Pritzker.
Happy to take any questions from members. Gia. Okay.
The tribune said today that the state and the city have been talking. And I'm wondering if you can talk about that, what your
I can tell you that those conversations have been ongoing for some time now. They're conversations really about how to react if certain things occur. Those conversations also have included, excuse me, talking to members of the clergy, who are also deeply concerned about their ability to protect people, to hospitals, also concerned about protecting people who are in their hospitals. It's a broad conversation. I'm not going to talk specifics about it because in reacting to something we don't know yet,